Hello and good day, everyone. My presentation today is titled A Design Science Study of Interface Design and Usability in Clinic Appointment Management System. This work is presented at 5th International Virtual Conference on Social Sciences Education and Innovation 2026. This study focuses on improving appointment management practices in private clinics by developing and evaluating an interface design grounded in real clinic workflows using a design science approach. In the following presentation, I will briefly introduce the problem context, describe the methodology used, present the main findings, and conclude with the contributions and future directions of the study. The study was conducted by myself, Nurhidayah Bahar, and Muhammad Farid Muhammad Saroni, both affiliated with Faculty of Information Science and Technology, University Kebangsaan Malaysia. The work forms part of ongoing efforts to explore requirement-driven system design to improve healthcare service operations through usable digital interfaces. Healthcare demand in Malaysia continues to grow due to population increase and greater awareness of primary healthcare services. Private general practitioner clinics play an important role in providing accessible outpatient care, especially where patients seek faster consultation. However, many clinics still rely on manual or partially manual appointment scheduling, which often leads to congestion, long waiting times, and operational inefficiencies. Therefore, there is a growing need to improve appointment management practices to better support clinic workflows and patient access to healthcare services. Many private clinics still rely on manual appointment scheduling, which often results in disorganized bookings, congestion, and prolonged waiting times. Manual systems also contribute to appointment no-shows, reducing clinic efficiency and affecting patient satisfaction. Appointment information is often managed separately across clinics, which can confuse patients and lead to duplicated consultations or tests. Although digital systems exist, many studies focus on system implementation rather than ensuring that interfaces match real clinic workflows and user needs. Therefore, this study aims to translate real appointment management workflow into a usable interface design and evaluate its effectiveness in supporting appointment scheduling and coordination. The study is guided by the research question: how can clinic appointment management workflows be translated into an interface design that effectively supports appointment scheduling and coordination tasks? Accordingly, the objective of this study are to elicit user and system requirements from real-time environments, develop system design artifacts to represent appointment management processes, design an interface prototype based on identified requirements, and evaluate the usability of the proposed interface in supporting appointment management tasks. This study adopted a qualitative approach to understand appointment management workflows and challenges in private clinics. In-depth interviews were conducted with doctors and clinic administrators from three GPs. Observation and document analysis were also performed to understand how appointments were managed in practice. Requirements were elicited using Somerville's requirements engineering process, where workflow issues were identified, organized into functional requirements, and refined with clinic representative. A design science approach was then applied to translate these requirements into design artifacts and interface prototypes, which were later evaluated through usability testing to assess their suitability for clinic operations. The results of the study are presented in four main parts. First, user requirements were identified to understand how patients, doctors, and administrators interact with appointment management processes. Second, system requirements were defined to ensure reliable and efficient system operation. These requirements were then translated into system design artifacts, including use case and data models. Finally, an interface prototype was developed and evaluated to assess its usability in supporting appointment management tasks. The system is designed to support three primary user groups involved in appointment management processes: patients, doctors, and clinic administrator. Each user group performs distinct roles within the system, and the requirements specify the system functionalities needed to support appointment scheduling, schedule management, and operational coordination in clinical settings. The following present the list of user functional requirements for each user group. First, patient requirements. For patients, the system is designed to allow access to online appointment services where they can view doctor availability and select preferred doctors when making bookings. Patients are also able to schedule appointments using specific time slot as well as modify or cancel appointments when necessary. The system also provides automatic notification when schedule changes occur and allow patients to store appointment information from other clinics for personal reference. Second, doctor requirements. For doctors, the system allows them to view patient appointment details and categories to better prepare for consultation. Doctors are also able to manage their duty schedules and adjust appointment slot durations according to clinic operational needs. In addition, the system enables doctors to monitor their daily and upcoming appointments and update appointment statuses, such as making consultations as completed, postponed, or cancelled. Third, administrator requirements. For administrators, the system supports management of doctors' duty schedules to ensure appointment slots are available for patient booking. Administrator can also monitor appointment lists, send appointment reminders, and generate reports for operational monitoring. In addition, they are able to manage patient and doctor profiles, reschedule appointments when necessary, control slot availability, and update appointment statuses, including confirmed, cancelled, or no-show cases to ensure smooth appointment coordination. In addition to user functional requirements, several system level requirements were identified to ensure that the appointment management system operates reliably, securely, and efficiently within clinic environment. These requirements define the expected operational characteristics of the system beyond user interaction, including performance, data management, and security considerations that is necessary to support daily clinic operation. At the system level, the platform ensures secure user authentication and protects appointment data through control access based on user roles. The system will also maintain appointment records for future reference and reporting while ensuring reliable operation during clinic hours. It also supports simultaneous access by multiple users, provides data backup to prevent information loss, and records scheduling activities for monitoring and operational control. Figure 1 present the use case diagram summarizing how the three main actors, patients, doctors, and administrators, interact with the appointment management system. For patients, the system support account access, viewing doctor availability, booking appointment using specific time slot, and managing appointment through rescheduling or cancellation. Patients also receive notification about schedule changes and can record appointments for other clinics for reference. For doctors, the system enables them to view their appointment schedules, access patient appointment details, update duty schedules, adjust consultation duration, and update appointment statuses after consultation. As for the administrators, the system supports broader operational management, including managing patient and doctor profiles, controlling duty schedules and appointment slot availability, monitoring appointment lists, rescheduling appointments when necessary, sending automated reminders, and generating operational reports. An entity relationship diagram (ERD) was developed to represent the core data structure required to support the clinic appointment management system. The ERD defines the main entities involved in appointment scheduling and management, as well as their relationship, to ensure consistent data organization and retrieval. The primary entities identified include user, login, clinic, doctor, patient, administrator, appointment slot, schedule, disease, and message notification. These entities collectively capture user information, authentication records, clinics and doctor details appointment, scheduling data, patient medical contacts, and notification processes necessary for appointment coordination. This ERD, it provides a structured representation of how appointment data, schedules, and user roles interact within the system. It also formed the foundation for subsequent system implementation and interface development. So basically, this figure presents the ERD of the proposed clinic appointment management system. A set of interface screen was developed to support end-to-end appointment management tasks for patients, doctors, and clinic administrators. The prototype covers key functions including appointment creation and modification, schedule viewing, notification handling, and profile management. The table shows the list of interfaces available in the clinic appointment management system prototype. These interfaces allows users to securely access the system, book and manage appointments, view doctor schedules, and receive notifications related to appointment updates. Additional functions support profile management, appointment monitoring by administrators, management of duty schedules, and generation of reports for clinic operation. Collectively, these interfaces provide comprehensive support for coordinating appointment activities within the clinic environments. This figure shows the doctor schedule interface, provides a calendar-based view on doctors' availability and scheduled appointments. The interface displays multiple doctor across columns with time slots arranged vertically, enabling users to view schedules for a selected date and navigate between dates using the calendar controls. The schedule view support different time perspective, for example, day or week, and includes filtering options to refine the displayed schedule based on service category. A new appointment function, as you can see it, is available to initiate appointment booking directly from the schedule view. The left navigation panel, it provides quick access to key modules including appointment list, doctor schedule, messages, and profile. Within the schedule grid, book slots are shown as time block entries associated with specific doctors, while unavailable periods, for example, they are off duty. These are visibly indicated. So the interface, it supports the requirement for more specific time slot, allocation, and clearer visibility of doctor availability, helping reduce ambiguity in scheduling and supporting smoother appointment planning. Usability evaluation was conducted to obtain user feedback on the proposed appointment management system interface. The results indicate positive user perception across all evaluation dimensions. The mean score for ease of use was 4.4, indicating that users found in the interface intuitive and easy to navigate. Perceived usefulness of the system recorded a mean score of 4.33, suggesting that respondents considered the system helpful in supporting appointment management tasks. The suitability of system function achieved a mean score of 4.3, reflecting that the provided functions align well with user needs. Finally, the overall interface design received a mean score of 4.4, indicating a generally favorable assessment of the system design and usability. In conclusion, the study shows that identified requirements can be successfully translated into system design artifacts and usable interface prototypes for appointment management. The developed prototype supports appointment scheduling tasks effectively, and usability evaluation indicates that users find the system easy to use and useful. This study contributes theoretically by demonstrating how real clinic workflow requirements can inform interface design, while practically providing guidance for clinics seeking to modernize their appointment management. However, the study is limited to prototype level evaluation involving a small number of clinics. Future work will involve full system implementation and broader usability evaluation to validate system effectiveness in real clinical environment. Thank you for your attention, and I hope this presentation has provided useful insights into improving clinic appointment management systems.